suffering from back pain, neck pain, migraines, or numbness in your body?
I used to get 2 migraines a month, average.
Have you sought relief only to find disappointment?
Personally, I believe by experience that drugs and surgery should be the last alternative, not the first alternative.
For many doctors, drugs or radical surgery are the only options for curing pain.
I didn't feel good on it. I had side effects. I felt dizzy. I felt nauseous.
But there is another way.
It was absolutely painless. It was the most comfortable treatment that I had ever had.
Today on Health Smart, Marsha McGilley talks with an expert who offers a natural alternative.
Hi, my name is Marsha McGilley, and you're watching Health Smart. I was in an auto accident recently. I had headaches, neck pain, and lower back pain that shot down my leg. Tonight, we're going to interview Dr. Visentin from Chiropractic. He's a natural healthcare specialist and a doctor of chiropractic. What he has to share with you is revolutionary. If you're at home, sitting there in pain, you need to stay tuned to this show. He helped me, and he can help you. Tell me how long you've been doing this.
I've been in practice over 20 years, and I've helped thousands and thousands of people, and I've done it naturally, without drugs and without surgery.
Wow. Tell me a little bit about what is special or distinctive about your practice.
Our approach is different. I know the body can actually heal itself. I believe that there's an intelligence that heals you, that you may very well be the miracle that you've been waiting for. And I know that if we establish balance in your life, eat right, rest, get some sleep, drink some water, do some basic things, and then do one more thing. Make sure your spine's in good alignment, that you'll stand your best chance of being and staying healthy.
Now, we've talked a lot about like my neck and back pain, but let's talk about what are some of the other things that you can help people with.
People come in with migraine headaches and do very well under my care. People who've suffered with headaches, who can't function anymore, do extremely well. Oftentimes, people will notice numbness and tingling in their arms, hands, or fingers. We help folks with carpal tunnel syndrome, people with repetitive motion problems, people who have mid-back pain, chest pain, numbness and tingling down the legs. And folks notice a lot of other benefits as well. Once they get their spine straightened out, they notice they can sleep better, they stand straighter, they have better posture. They really start to open up and enjoy their lives again, the way that we were meant to be and stay healthy over a lifetime, naturally.
What can you do for me with my back and pain here? What is it that you would actually do?
What I do is create balance in the body, because I know that the body is a self-healing system. You believe your body can heal itself, right? Mm-hmm. If you were to cut yourself, who heals you? Where does the healing come from?
Well, I'd put ointment and a Band-Aid, and then
but ultimately,
my body,
where does it come from?
My own cells would heal itself.
Exactly. Your body's very intelligent, and you can actually heal yourself, and you will heal yourself to the best of your ability when things are in good balance. And I mean all of balance, nutritionally, mentally, and most of all structurally, at the level of the spine and nerve system. Because you can imagine, there's tremendous power, life, and energy, healing forces that come from the brain and move through the spine. And when everything's lined up properly, there's a flow of energy from above down and from the inside out to actually heal you. So as old and sick and dying cells are replaced by new healthy ones, that's how we recreate or regenerate ourselves from within. It's always an inside job.
How is what you do as a chiropractor different from other treatments?
Most treatments are applied from the outside in. For example, your medical doctor, as well-meaning as she is, was going to give you drugs. We call them medicine, but it's really drugs. And then failing that, inject you with drugs, or maybe rip pieces of your spine out. I don't think that you're going to be any healthier by ripping pieces of the body out.
None of that felt good to me inside. I just was like, oh no, this doesn't even feel good.
I don't think you need anything added to your body in the form of toxins or drugs or parts ripped out. I think that you were born with all the parts necessary to keep you healthy. Genuine parts, not GM, but GOD, I like to say. Factory direct, and I think you should keep all your parts. There's a time and place for drugging and for surgery, but You want to go the most conservative route first, and what I do, gently realigns the vertebrae of the spine. I use a handheld instrument that gently realigns the vertebrae of the spine and allows the body to heal itself naturally.
So I come into your office for the first time. I'm a new patient. What is it that you do with us?
First, I take a careful history. I listen, really listen to what the problem is. Then I do some examination as well, orthopedic, physical, neurological, do some muscle strength tests, some range of motion tests, and any other tests that are necessary. I'd also perform x-rays if they were necessary, and only if they were necessary. And then I'd report to you, I'd sit down and tell you in plain English what we found. With your husband there, I'd explain and show you the x-ray, show you what a normal x-ray should look like, and compare it with your x-ray, and show you where you might be out of alignment. It sounds like your spine was thrown out of place by the accident, and it'll be made right again when it's put right, when it's adjusted or gently put back in place, and that's what the body responds to.
What benefits do people experience after they've come see you?
After a couple of weeks, most of my patients notice a dramatic reduction in their pain. And then they start to sleep better, feel better, look better, move easier, live the abundant, natural, healthy life that God meant for them. Live up to their potential, whatever that potential might be. They notice their posture improves. They feel more confident. They feel more in touch with themselves. They recover faster after exertion, characteristically. They notice a lot of secondary benefits because if the spine's out of alignment, that's a drag on the entire body. When the spine's put right again, with gentle, natural, effective care, people start to express their amazing potential that comes through their nerve system. When everything's lined up in their spine, power, life, and energy can roar through from the brain, through the spine, outward to those 11 trillion cells inside of us so that we can be and stay as healthy as we were meant to be.
So you use a handheld device? What's that?
I have a handheld device here that actually sets the vertebra in motion and allows the body to gently heal itself. Can I show you how it feels?
Does it hurt?
No, it doesn't hurt. It'll feel like a click. How does
That's
that
all?
feel? That's all.
It's like a little bit harder push with a knuckle. That doesn't hurt. That's what you use on my spine.
And amazingly, your body wants to be and stay healthy. It's designed to be and stay healthy. It hates being out of alignment. And if you gently reduce what scientists call the subluxation, you gently realign the vertebrae, it'll actually regenerate itself. It has an amazing capacity to heal itself. It wants to do that. It's designed for that.
I think we've got a couple of clips here from you with some of your patients. So I think we ought to go to those and let the viewing audience see what it is that you actually do with your patients.
I absolutely could not get up. I couldn't roll to my side. My head hurt, my back hurt, my legs hurt. I was in a lot of pain.
Really terrible. 10 out of 10, excruciating pain, migraines is what I was having.
I could not put any weight on my knee. If I stood up, I could not stand on it.
When I walked in, I couldn't really do what you call walk because my back was killing me.
I have to crawl across the floor, pull myself up. I can't stand up straight.
It was a lot of pain on my legs, my back, my shoulders.
It was horrible. I could not lift my arm over my head. I couldn't use my arm. I couldn't play with my kids. I couldn't put my socks on. I couldn't even pull my pants up.
The pain was down the back on the side that was most affected by the polio. Then it began spreading to the left side.
I noticed results almost immediately. I felt better as soon as he started working on me on my first visit. I noticed that my back pains was getting a little better.
I healed faster than what I would have normally. I didn't have to call in sick.
It was like night and day. I could actually walk on my knee.
I could not walk. And when Dr. V got through with me, I could walk out of here.
I can now exercise when I could not exercise. I can run. I can play sports again.
I was able to walk a little better and my back wasn't hurting. I could sleep better.
First and foremost, I noticed that, he's called Chiropractic, and it's true, he cares.
This was real. These people cared. And even though I didn't believe in it at the beginning, it was really helping.
43-year-old female with lifetime migraines, resolved.
That was remarkable to me. without the aid of medicine.
33-year-old male construction worker with chronic lower back pain, completely resolved.
I'm really happy with the result. It's been a real blessing.
When people are in pain, they'll do anything to get relief. Some of them are facing surgery, and the best surgeons will tell you that all surgery is dangerous. What I do gets great results because we use safe, gentle, and effective methods to get people well naturally.
The relief was phenomenal.
If you have pain of any kind, give my center a call so that we can talk about it. Sometimes people are afraid to call a professional. They're afraid that that person may not listen to them or understand their pain. If I can't help you, I'll tell you so.
Like a miracle.
You have nothing to lose but the pain.
How long is it before when a patient comes in to see you, before they're out doing their normal life again?
Someone like you who looks healthy, takes care of themselves, will do extremely well. Someone who comes in right after they've been hurt or right when the pain first comes on, they stand a better chance. All too often, folks stay at home, and you might have viewers right now that are at home and they're hurting, and they don't get proper care. And if the pain keeps coming back, or it's getting worse over time, or if it doesn't go away, that's potentially very serious, and they should call a doctor.
So if I pick up the laundry and twist my back and I have pain, or I fall down or in the snow or ice, or something like that, the sooner I get in to see you, the better. Is that what you're saying?
The faster you heal. A lot of my patients mention that after they started care, the only regret they have is not having started sooner.
How is your care different from seeing your regular doctor?
The approach is different. We don't just try to hide the pain with drugs or surgery. We actually create balance in the body by gently realigning the vertebrae. Then power, life, love, energy, healing forces can move through you, from your brain, through your spine, outward to the living cells. There's 11 trillion cells inside of you, and they're all controlled and coordinated by that delicate and sensitive nervous system inside of you. And as old, sick, and dying cells are replaced by new, healthy cells, your body can actually regenerate. And those are the systems that we activate when we gently realign the vertebrae in your spine.
I'm over 40, I hate to admit that, but many of the things my doctor tells me are just, I'm aging. What's your response to that?
Did you know the limits on human aging run 143 years of age? Did you know that?
No. Wow.
The scientists and doctors say we should live a lot longer, that we were built for health and wellness, abundant health, and to live above the crowd, live a different kind of life. We're only scratching into just a little bit of our potential. We live to about 70, 80 years, as you know, and most of the people around us, they don't feel good, they're not healthy, they're not having a good time, so we assume after a time that it's normal to be sick. And I don't think you're old at all. In fact, you don't look old to me, and I think there's a lot more coming. But you have to establish balance in your life, and getting your spine checked and making sure that all the vertebrae are in proper alignment and that your nervous system is functioning at 100% is your responsibility as well. When's the last time you've had your spine checked?
Never.
Never. In most instances, that's people's response. They just take it for granted. We get our teeth checked, our tires checked, our leaders and gutters checked in our house, but our spine we don't even think about till it starts to go bad, until it starts to break down.
So if you're just a healthy person and you haven't had a fall or anything, what's the protocol for how long or when you should visit a chiropractor to keep yourself healthy?
It really depends, but you should get your spine checked on a regular basis. If you're older, if you're feeling stiff, it's time to pick up the phone and make a move. A lot of folks just live in denial. I have a lot of gentlemen in particular. They'll come in and they'll go, well, I have back pain, but it's normal for me. Well, back pain's not normal for anyone. Certainly you could go to the gym and work out and have some soreness, but that soreness should go away within a few days. But if it keeps coming back, or if it remains the same, or if it's getting worse, that's a problem. And that's the time to do something and not live in denial. If you have numbness and tingling in your arms or legs or down your legs, that's potentially very serious. That's serious interference with the nerve system, and something should be done about it. And the first thing to do are conservative measures, then drugs, and then surgery. I say chiropractic first because it's conservative. We gently realign the spine, taking pressure off the nerve system, allowing the body to heal itself. And then drugs second, because you know that drugs have side effects, right? And surgery can be very dangerous, can be devastating. So that would be the last thing that anyone should do?
Well, I'd like to ask, because my husband's very skeptical about this kind of natural health care kind of field, and he has knee problems with running. So occasionally he'll, get out of bed in the morning and, he's just a little, I call it kind of creaky and crotchety, and his knee hurts. And I've told him, you're going to have surgery one day if you don't get that checked. What would you do with and he runs on the treadmill or on a path, a dirt path by our home, fairly regularly when his knee's not hurting.
I'm very good with knees.
You are.
And the first thing we do all the standard tests. And then we set him forward on a special table, and we do some advanced neurological and orthopedic tests to determine if his knee is in proper alignment. Oftentimes, a gentle adjustment or putting the knee bones back in place can actually allow for healing. A lot of people at my center have avoided surgery through the gentle techniques that we implement.
So I'd like to give the viewers that might be experiencing any of those kinds of pains right now your phone number. If you're experiencing any of these kinds of pains, chronic, sharp, numbness, tingling, something that keeps coming back and you're up listening to this tonight, I'd like to give you Dr. Visentin's phone number. It's 303-394-CARE. That's 303-394-CARE.
Pain in my neck, which extended to my shoulders.
And I couldn't hardly get in and out of a car because my hips hurt me so bad.
Starting to get migraine headaches. My neck is really stiff. I had back pains, shoulders. My shoulders were really hurting.
I just had burning pain, just a burning sensation between my shoulder blades, and my fingertips were going numb.
Like there was pain through my left arm, all the way into my shoulder.
I hurt all over my body.
After the initial treatment, I could feel some relief. I could feel some loosening in my neck and the symptoms, but the most, I think, dramatic realization was that my headaches almost immediately cleared up.
With the activators, you don't feel anything. It adjusts you, but you don't feel a thing.
Don't be afraid. Don't be afraid, because you're keeping yourself from getting well. You're keeping yourself from feeling better, from having a better life, and being able to be comfortable with yourself.
I'm a gospel singer, and it has allowed me to breathe more deeply, which is really important because you need to sustain notes.
But I noticed more flexibility and an increase in energy.
I started off coming here, walking on a walker, and before you know it, I was on a cane. And now you see that I don't have a cane at all.
43-year-old female with lifetime migraines, resolved.
That was remarkable to me without the aid of medicine.
27-year-old female, post-whiplash discal protrusion, resolved.
The relief was phenomenal.
When people are in pain, they'll do anything to get relief. Taking drugs is not the answer. All drugs have side effects, including addiction. What I do gets great results because we use safe, gentle, and effective methods. To get people well naturally, I use a handheld instrument that gently realigns the bones of the spine.
Nothing works as well as the activator method.
Give my center a call. Let's talk about your pain and see what can be done about it naturally.
I couldn't hardly walk, but now I can walk. Like a miracle.
You have nothing to lose but the pain. All pains resolved.
Is chiropractic care affordable?
We're very affordable. We work with all insurance companies that work with us. But a lot of folks don't have insurance these days, and I'm sympathetic to that, and I'm willing to work with them to make it affordable.
I was wondering, is there anything that I can do at home to check whether or not I need to come in, or if I'm doing okay, or anything that our viewers could do?
Let's do some tests right here on the air, okay? This will be fun. Turn your head and give a big cough. Just give a big cough. Does that hurt you anywhere?
No.
So some of your viewers might be out there and they give a big cough, and some of them might have neck pain or back pain, and if you have that, that's definitely not okay. That's a sign that there's something wrong. And that's a time to make a move. It's not okay to have those pains. And if they have a cough, if they cough and their neck or their back hurts, it means that the problem has a physical aspect. And if it's physical, then I can help. Let's do some more tests. Put your head back as far as you can. Put your head back as far as you can. Does that hurt? Don't hurt yourself, but does that hurt? It shouldn't hurt. Go ahead, push it back a little bit further now, and gently push the top of your head back with your hand. Take your hand and push the top of your head back and gently push your head back. Don't hurt yourself. Does that hurt?
It just sort of pulls here, but it doesn't hurt.
Okay, that shouldn't hurt either. If people have neck pain, for example, with that, or they experience numbness and tingling down their arms or hands or fingers, I'm no advocate of self-diagnosis, certainly. But there's something wrong there, and the problem has a physical aspect. And if it is physical, then there's a potential that I could do them a lot of good. Do one more test with me, though. Go ahead and straighten, put your feet together and straighten one leg out and see how your back feels. Straighten your leg out all the way. Does that hurt at all?
I can feel my muscles pulling, but it doesn't hurt.
Doesn't hurt your back. It shouldn't hurt your back. If your listeners or your viewers are home and they feel back pain with this, that's not okay. And it means the problem's physical and potentially serious. Bring your head forward now. Put both legs out and give a big cough at the same time. Put your head forward. Does that bother you?
No.
So these are tests for the spine and nerve system. If those tests hurt anywhere in the spine, that's not okay. And it's time for the viewers to stop kidding themselves. If they're living with that kind of pain day in and day out, do something about it. It's definitely not okay. And if you did those tests and you had pain, that means there's a potential that I could do you a lot of good, because the problem is of a physical nature, and if it's physical, then I could help.
Can you check me out right now?
You bet. Would you like me to check your spine? Put your head forward, and let's check your spinal alignment right over here. I'm not going to mess up your hair, I promise. But it feels like, let me feel your neck right in there.
Sure.
You feel that?
Oh, yeah.
That neck bone is crooked. And if your neck bone is crooked, it can interfere with the nerves that go into your arms, hands, and into your fingers. Also, your shoulder's really tight. You could feel that right up in there and right up in there. That's not okay either. So you're carrying a lot of tension in here, and it may have been because of that accident. How about these vertebrae? 1, 2, 3, 4, 5, or 6, Marcia. Any problem with that? No. There's a lot of tightness here in your shoulder. This is called the rhomboideus muscle, and you're carrying a lot of tightness in there. How about this? 7, 8, 9, 10, 11, or 12.
Those
is that
down
okay?
there, sore.
Sore. How about these? 5, 4, 3, 2, or 1. Any problem with that?
A little sore.
All righty.
I need to come in, don't I?
You lived through that one, didn't you?
I need to come in and see you, don't I?
All righty. Yeah, you do.
Okay, I'm going to have to call and make an appointment. What if we don't get spinal care? I mean, is it really necessary?
It's necessary because our spine and nervous system conduct powers, forces through us to enliven us and to heal us from within, to guide us. So the master maker of the universe didn't leave us alone and masterless. He stayed on the job as an intelligence within, and that intelligence is expressed through the nerve system. So energy, life, healing starts in the brain, moves through the spine, and if everything's lined up, we'll stand our best chance of being and staying healthy. But if one vertebra, and I'd like the cameraman to focus in on this, if one vertebra should move out of place, the spine can actually degenerate. We also have regenerative capacities as well, so it could go in either direction. It is necessary to get yourself checked out for bones out of place, because that can be a serious dis-ease or disease to the nerve system and impact the nerve system and the way the body functions. And with proper care, you'll stand your best chance of being and staying healthy.
You know, I have a friend who recently had spinal surgery, and she is still in a lot of pain. Is there anything you can do to help her?
I love helping those folks. They do extremely well with the techniques that we utilize at our center. And many of them get back to doing activities that they haven't been able to do for a long period of time. Some of them get back to chopping wood or bowling or doing other things that they never dreamed possible after the surgery. So surgery is very serious, and oftentimes people don't recover 100%. But our techniques are gentle enough to actually realign the vertebrae and let that person live up to their potential, whatever it might be.
Why can't I just wait until the pain goes away?
Unfortunately, spinal decay, or degeneration, as scientists and doctors say, is like tooth decay. You can have degenerative changes in your spine ongoing without you even being aware of them. So you could be getting worse over time, eventually doing permanent damage to the spine and nerve system. So it's essential that your viewers get help. If you've been out there, you're suffering. You might be sitting there right now. And the reason why you're watching TV is you're in too much pain to do anything else. If your neck hurts, or you're having headaches, or you have numbness and tingling going down your arms, hands, or into your fingers, or mid-back pain, or lower back pain, or pain going down your legs, it's time to do something about it. That's not okay. And stop living in denial and make a move and maybe pick up the phone and get some help.
If you're listening right now and you call Dr. Visentin's office, you can get the following $150 package for free. This package includes free professional chiropractic spinal analysis, free thorough history consultation and diagnosis, a free doctor's report, which your significant other or spouse can attend, free use of a soothing therapeutic massage table, and free patient orientation. All of this free to you, simply by calling Dr. Visentin's office. I'd like to give you that number again. It's 303-394-CARE. That's 303-394-CARE. 303-394-2273. Thank you so much for being here today. I so appreciate your time and your expertise. It's been most enjoyable talking with you and learning from you, and I will be calling the office for an appointment very soon. Thanks for being here. I appreciate it.
You're welcome.
I had no idea what to expect when I first came here, and I too was afraid of the unknown. But once you get educated and you learn about it, how to turn the power on, how to make your body feel better.
It is very effective, and it's easy, and it's fast.
It's not painful like in the old days where they turn you into a pretzel and then push all your buttons and you walk out like the hunchback in Notre Dame.
He doesn't press on you. He doesn't do anything that hurts.
You can just hide behind something and just hope you get better, or you can come in and try it out.
This is nothing to fear, and it's never too late to get proactive in your health care.
You're going to see the change in your life. You're going to walk more comfortable, live more comfortable. You're definitely going to sleep a lot better.
43-year-old female with lifetime migraines, resolved.
That was remarkable to me without the aid of medicine.
33-year-old male construction worker with chronic lower back pain, completely resolved.
I'm really happy with the result. It's been a real blessing.
When people are in pain, they'll do anything to get relief, including pills. But unfortunately, all medications have side effects, like addiction. What I do gets great results because we use safe, gentle, and effective methods to get people well naturally.
The relief was phenomenal.
If you have pain of any kind, give my center a call so that we can talk about it.
Nothing works as well as the activator method.
After leaving Dr. Visentin's, I felt 100% better.
I want to be pain-free.
If I can't help you, I'll tell you so.
Like a miracle.
You have nothing to lose but the pain.